Hello everyone, welcome back to our channel. Our channel is a complete anatomy channel. Those who are not subscribed to the channel, do subscribe now. Our channel contains more than 250 anatomy videos which will be very helpful for the first MBBS students, and very important playlist, important anatomy in 50 videos, which contains all the 50 essays in the gross anatomy. All of you go through that important anatomy in 50 videos before your university exam. It's sure to pass with distinction. Today's topic is osteology of the humerus. As the first MBBS batch starts the upper limb dissection, I have started with the osteology of the upper limb. We have already covered the osteology of clavicle and osteology of scapula in the channel. Those who have not seen that videos, you go through it. Then the humerus will be helpful for you. Now, in this osteology of the humerus, so do you know the humerus? Humerus is the bone of the arm. It represents the bone of the arm, and it presents one upper end. So this is the upper end, and it presents one lower end and the shaft. So it's the long bone. So it will contain two ends and the middle shaft. So we will see the parts one by one. The head. It is a part of upper end. The upper end presents head of the humerus. So this is the head of the humerus, upper end, and also it contains greater tubercle, lesser tubercle, and intertubercular sulcus and the neck. So these are the parts of the upper end: head of the humerus, greater tubercle, lesser tubercle, neck, and intertubercular sulcus. We will see the next picture for this upper end, which will be useful for you. So this is the upper end of the humerus. The head, if you see, this part is the head of the humerus, which is the articular part. It is the articular part of the head humerus. It is spheroidal, which is about 1/3 of a sphere. It is articulating with the glenoid cavity to form the shoulder joint. The shoulder joint you will see in detail in the next dissections. So that part I will not cover now. The important part in this head of the humerus, the axis of the humeral head. So this is the axis of the humeral head, which makes an angle of 164 degree with the lower end of the humerus. That is called angle of humeral torsion. So this will be asked in the viva in the osteology of the humerus. So that point you should know. The angle of the humeral head with the lower end of the humerus is called as angle of humeral torsion, which is about 164 degree. So we have completed the head of the humerus. We will now see the two projections in the upper end, the lesser tubercle. So this is the lesser tubercle and the greater tubercle. We will see one by one. The lesser tubercle is slight just beyond this part head, that is the lesser tubercle. So what is attached to the lesser tubercle is subscapularis tendon. So that is it receives the insertion of the subscapularis tendon, which is slightly extending also into the shaft. So it is separated from this greater tubercle and lesser tubercle. Are you seeing this is the greater tubercle? This is, and this is lesser tubercle. This is separated in the middle by this intertubercular sulcus in between the tubercle. So that is the intertubercular sulcus, which will give, so that intertubercular sulcus will give attachment to one ligament, that will be the transverse humeral ligament. So that is the intertubercular sulcus. Now we will see the greater tubercle. This greater tubercle, it is slightly prominent than the lesser. That's why it is called greater, and the other one is called lesser. Greater tubercle, it is the most lateral part. So how we have to identify this side of the humerus? After you know all the parts, I will tell how to identify the side of the humerus. For any bone, As soon as you take the bone in the viva, you have to identify the side of the bone. That is the first question you have to face in the exam. So I will tell the features to identify the side of the bone after we complete all the parts of the bone. So this greater tubercle is lateral, so that should be projecting lateral, and this it receives the insertion of three muscles. So this greater tubercle receives the insertion of three muscles, supraspinatus. So that you will learn in the scapula it takes origin supraspinatus, infraspinatus. So that is above spine of scapula, below the spine of scapula. So supraspinatus, infraspinatus. Teres minor. Teres means, do you know the meaning teres? In the general anatomy muscle class, teres means round. So this one is minor. One muscle is less prominent. Other muscle you will learn it is teres major. So these three muscles are inserted into the greater tubercle. So what are the four muscles you have learned around the head of the humerus? Subscapularis, supraspinatus, infraspinatus, teres minor. So what is this joint we told? Shoulder joint. So you have to understand these four muscles attached to this greater tubercle and lesser tubercle will form one cuff for the shoulder that will be called as rotator cuff. So that is a one supporting mechanism or supporting phenomena for the shoulder joint, rotator cuff. That may be the short notes, which is formed by four muscles. You have to understand how it is taking origin. This all these four muscles taking origin from here. The what is the bone? Scapula. So that is the origin of these four muscles. They are inserted into the upper end of the humerus. They form the rotator cuff of the shoulder joint. So we have completed head of the humerus, greater tubercle, lesser tubercle. Now we will see the neck of the humerus. Neck of the humerus is very interesting. It possesses three types of neck of the humerus. One is this anatomical neck, another is this surgical neck. One more it is not given in this picture is this morphological neck. So three types of neck in the humerus: anatomical, surgical, and morphological. What is anatomical? Anatomical is always perfect anatomy. So anatomical is always we should tell junction of the head. So that this is the junction of the head and the other part. So that is called as the anatomical neck. That immediately that constriction immediately succeeds the head. That is anatomical. Surgical neck is this. So this is the surgical neck below the tubercle. So below the head is anatomical neck, below the tubercle is surgical neck. It's the constriction between the upper end and the shaft is called as the surgical neck. So this surgical neck is very important for us. It is related to one nerve and artery, that is axillary nerve and posterior circumflex humeral artery. So any fracture in this surgical neck will lead to the injury of this axillary nerve. Axillary nerve will supply deltoid muscle. So that will lead to the paralysis of the deltoid muscle. Then what is morphological neck? Morphological neck is represented by the epiphyseal line between the upper epiphysis and diaphysis. It is usually below the surgical neck, 0.5 centimeter above the surgical neck. So that is below, morphological neck is below 0.5 centimeter below the surgical neck. In adult, the morphological neck disappears. It is the morphological neck we can't identify in the humerus. So now we will move on to the shaft. Shaft we will see in the next picture. So this we can see the shaft in this picture clearly. Shaft of humerus is cylindrical in the upper half. So this half is cylindrical and lower half is triangular in cross section. So that is the junction of two different parts of the humerus. So at this part, so many changes take place in the arm, front of the arm. So you have to learn this part, uh, upper and lower half of the humerus, like that, where many changes will take place in the front of the arm. You try to learn one. For example, I will tell in this front, in this exactly at this point, the median nerve will cross. Median nerve will cross from lateral to median. So like this, you have to list out many features like this, more than 5 features in this front of the arm you should learn. Now we will move on again to the shaft. The shaft presents 3 borders. So what are the borders? Shaft presents anterior border, medial border, and lateral border. So these are the 3 borders. First we will cover borders, then we will learn the surfaces. So anterior border, are you seeing anterior border? So this is the anterior border, extends from the greater tubercle to this. So this is the anterior border, extends from the greater tubercle to the lower end of the humerus in between the coronoid and radial fossa. So this is, we will learn lower end, we will have 2 fossa, coronoid and radial fossa. So that is the anterior border. Lower half, lower half of the border is smooth and rounded. Then medial border. Medial border, we have to start from here. So this is the medial border, which is extending from the medial epicondyle to the medial lip of the intertubercular sulcus. Then lateral border extends from the lateral epicondyle. So that are the 3 borders. Now what are the 3 surfaces we will learn? Anteromedial surface, then anterolateral surface and posterior surface. So first we will see this anteromedial surface. So are they seeing this surface? In between this anterior border and medial border, that is called as anteromedial surface. So in this anteromedial surface, what is this important feature in the anteromedial surface is intertubercular sulcus. So it gives attachment to 3 muscles. This intertubercular sulcus gives attachment to 3 muscles: pectoralis major, teres major, and latissimus dorsi. So pectoralis major, you will see in the first dissection in the pectoralis region, pectoral region, that is at the front of the trunk. You will learn pectoralis major. Teres major is the scapular muscles. And latissimus dorsi. Latissimus means broader. So latissimus, you will learn in the back dissection. Latissimus, that is wider muscles will be called latissimus, and the longer muscles will be called as longissimus. So this latissimus dorsi is inserted in the middle, and 2 major muscles are inserted on the lips of the intertubercular sulcus. Then this middle part of this anteromedial surface receives the insertion of coracobrachialis that you will learn in the front of the arm muscles. So that is the coracobrachialis. Then this lower end of the anteromedial, both anteromedial and anterolateral surface will give the origin of the brachialis muscle. That is again the front of the arm muscles. So many muscle names I am telling. You try to understand slowly one by one when you start dissecting the pectoral region, back, axilla, you will understand. Then this medial supracondylar ridge, that is this lower end of this border will be called as medial supracondylar, above the condyle. So that is supracondylar ridge. So that will give attachment to the medial septum of the arm. So that will divide this arm into front of the arm and back of the arm. So this medial septum will be pierced in the middle by this ulnar nerve and superior ulnar collateral artery. That is the structures piercing the medial septum of the arm. Then now we will see the anterolateral surface. Anterolateral surface intervenes between what borders? Anterior border and lateral border. So in the middle of the anterolateral surface, we have the V-shaped deltoid tuberosity. So this deltoid tuberosity will give insertion to, if the name itself tells, it gives insertion to the deltoid muscle. So rest of the surface we have already learned, which is both anteromedial and anterolateral surface will give origin to the brachialis muscle. Then this lateral supracondylar ridge, that is the lower part of the lateral border, will give attachment to the lateral septum. This lateral septum will be pierced by the radial nerve and by the anterior descending branch of profunda brachial artery. So these are the structures piercing the lateral septum of the arm. So medial septum and lateral septum will separate the arm into front of arm and back of arm. Posterior surface, which is not seen in this picture, so you have to turn the bone and you have to see that is the posterior surface that was presented by the spiral groove or radial groove. Radial groove or spiral, it is spiral in shape. So the name itself tells what is related to radial groove. Radial nerve, this is very important. Radial groove is containing this radial nerve. This groove is caused by the radial nerve running in relation to the middle of the posterior surface of the humerus. So we have learnt already two nerves. One nerve already related to a surgical neck, that is the axillary nerve. Now another nerve which is related to the posterior surface of the humerus is radial nerve. You will be asked three nerves related to the humerus. One and axillary nerve I have told, radial nerve. Another nerve we will learn in the lower end of the humerus. Then this above the radial groove in the posterior surface we have the radial groove. Above the radial groove, one origin, below the radial groove, what is the muscle in the back of the arm is only one muscle, triceps. Triceps. Tri means three, triceps. It has three heads, long head, lateral head, and medial head. So thus, above the radial groove, lateral head takes the origin. Below the radial groove, medial head takes the origin. So back of the arm is simple for you in the exam if you are given only one muscle, triceps. Long head, lateral head, and medial head. So that will take origin. Long head will be taking origin from the scapula. Lateral head and medial head will take origin from the posterior surface of the humerus. Above the radial groove, lateral head. Below the radial head, what head? Medial head. So we have completed the shaft of the humerus. Now we will move on to the lower end of the humerus. You will see the next picture. Yes, this is very clear for you. Lower end of the humerus. So lower end of the humerus, we will start. The lower end of the humerus is enlarged to form the condyles. So these are the condyles. On both sides, we have the condyles, medial and lateral condyles. So there are two condyles that is enlarged, that is condyle, which contains articular part and non-articular part. So articular part will form the elbow joint. So what are the non-articular parts also we will see, articular and non-articular parts. Articular part first we will see, it consists of capitulum laterally and trochlea medially. So these are the articular parts, capitulum and trochlea. So these are the articular parts. Trochlea is pulley-like. So this is trochlea. So that should be lateral. Capitulum should be medial. So by this, all this only you can identify the side of the humerus. So the capitulum is laterally and trochlea is medially. So I think this is medial, no? So this is trochlea medially and capitulum laterally. So the capitulum is less than the half of the sphere. So this is like spherical shape. Trochlea is asymmetrical fully. So the trochlea is asymmetrical fully. So this capitulum will articulate. This capitulum will articulate with the, so it is spherical. So it will articulate with the head of the humerus. This trochlea will articulate with the ulna, trochlear notch of the ulna. So which bone is medial in the forearm? Ulna. So this medial part trochlea will articulate with trochlear notch of the ulna, and this capitulum will articulate with the head of the radius. The medial part of the trochlea, you see, this is the medial flange of the trochlea, is more broader than the, and its medial margin extends about 6 millimeter below the lateral margin. So this medial margin of the trochlea. That's why the forearm is deviated away from the upper arm in extended and supinated position. So all of you see your upper limb. This forearm is deviated from the upper arm. That part that is called as carrying angle. Carrying angle, which is called cause of this carrying angle is medial margin of the trochlea, which is 6 millimeter extending below than the lateral angle. So this is mainly to carry out the function of the upper limb. So that this angle helps to carry any load grasped by the upper end, upper limb without any contact of the ulnar border of the forearm with the lateral surface of the thigh. So this carrying angle but disappears in flexion and pronation of the forearm. Carrying angle you can appreciate only in the extended and supinated. That is in the anatomical position you can appreciate. What are the non-articular parts? Non-articular parts we are having, or you see, this is the radial fossa, coronoid fossa in the anterior surface, anterior view, and the olecranon fossa in the posterior surface. The name itself tells what it will be related to. So this radial fossa, here are you seeing this, what it is, the capitulum is articulating with the head of the radius. So when you flex the elbow, this radius will be resting on the radial fossa. Same like here, this part is articulating with the trochlear notch of the ulna. In the flexed position, the coronoid process of ulna will be related to this part. Then this olecranon fossa is a deep depression present in the posterior surface of the lower end. It larges the apex of the olecranon process. This is in extended elbow. These two in the flexed elbow, and this is in the extended elbow. Then all non-articular fossa are but covered within the articular capsule. Then this medial epicondyle, that is a projection in the medial epicondyle and lateral epicondyle, or projection in the condyles. They are called as epicondyle. That will be continuous above with the medial supracondylar ridge and the lateral supracondylar ridge. The attachments in the medial epicondyle and lateral epicondyle will be the forearm muscles, flexors and extensors of the forearm muscles. You will be learning in the forearm dissection. So we have completed in detail this humerus. Now we will see the ossification. Ossification of the humerus is from three centers, one primary center for the shaft, primary center, and three secondary centers for the upper end, four secondary centers for the lower end. You try to learn ossification centers, which will be given all in this, in all the textbooks. I am not going to tell all about details of the ossification centers, but roughly I have told one primary and seven secondary centers for the ossification. Then one more nerve related to the behind the medial epicondyle is the ulnar nerve. So now I have told three nerves related to the humerus, axillary nerve around the surgical neck, and radial nerve in the spiral groove, and ulnar nerve behind the medial epicondyle. So what are the summary points in the humerus? Scapulohumeral muscles are attached around the upper end of the humerus. Thoracohumeral muscles are attached along the intertubercular sulcus. Upper half of the humerus receives only the insertion of the muscle, except the lateral head. Lower half of the humerus provides the origin of the muscles. Three nerves already we have told. What is this applied anatomy of the humerus? Osteology of the humerus is common sites of fracture of the humerus are the surgical neck. So we have to be careful and see whether the axillary nerve is injured, or in the middle of the shaft. Middle of the shaft, again we are worried because this part is having poor blood supply, so that may be related with the delayed union of the humerus. So since the fusion of the upper epiphysis takes place later than the lower epiphysis, upper end of the humerus is the growing end of the humerus. We have completed the osteology of the humerus in very detail in this video, covering every part. If you see the osteology classes, some faculties will tell only the parts of the any bone. Some faculties will tell always again with the origin, insertion, special features. My class is always the complete osteology class covering all the special features. I hope it will be useful for the students. If you have any doubts in this osteology of the humerus, you can post in the comments. We will continue with the classes of the upper limb in the next videos. Those who are not subscribed to the channel, do subscribe now and so that you will receive the notification. I'll be covering upper limb, lower limb and in continuity with your syllabus so that it will be helpful for you. Okay, we will meet in the next class. Thank you.